Hello, my name is Michael O'Neill, and today we're going to talk about the fetal care theory and the pros and cons of it. Now, I believe the fetal care theory is wrong because they practice protocol over emotions. This basically states that doctors or hospitals should have the right to refuse support to a patient who they believe is inadequate or not worth spending those resources on. This is wrong in my opinion because they don't take into consideration the emotional value that the patient has to the family or the financial aspect of it, or how much that patient deals with the family as far as paying for everything. This, in my opinion, can also be countered with the hospital needs to have some type of way of cost containment, and I understand that. It could sometimes be a lot more costly to keep a person alive than it would be to just allow them to pass on. In certain situations, it would just be prolonging how long the person lives, and keeping them alive wouldn't really do anything if they're going to die pretty soon anyway. I also believe that it's wrong because doctors can sometimes doom patients who beforehand said they would like to live. This can also be countered with the fact that certain patients who are elderly or terminally ill, it would just be prolonging how long they are inevitably going to die. So if a healthier patient needs whatever room they're in or any resources that they need, then it would be understood of why the hospital or doctor would allow that person to die. I also believe that pretty much the only reason why the fetal care theory is appreciated by the fetal care theorists is because of cost containment. A lot of situations that involve fetal care theory happen to be very terminally ill people or people that it's just very difficult to keep them alive, and especially financially. This is very evident in the Terry Schiavo case. With Terry Schiavo, she suffered a heart attack which caused her to lose air going to her brain. This basically left her in a vegetative state in which later she recovered partly as she was able to breathe on her own, but at the same time she could not speak. So her husband made the case to allow the hospital to kill her. They dehydrated her by not giving her water for 2 weeks. This was a very controversial case, and it seems like this will be a lot bigger as we go forward in America, as a lot of people, such as myself, believe that hospitals or doctors should not have the right to be able to tell whether a patient can live or die. That should be completely up to the patient.